The Mental Health Association Malta, MHA, has raised urgent concerns and expressed deep disappointment following alarming reports regarding a patient who escaped from Mount Carmel Hospital. This individual, who was under psychiatric care, managed to leave the facility without supervision and was later discovered with severe, life-threatening injuries. In a powerful statement, the MHA underscored that this incident is not an isolated case, but rather indicative of a disturbing trend of systemic negligence. They pointed out that there have been numerous warnings regarding patient safety, chronic staff shortages, and insufficient infrastructure, all of which have been largely ignored. The association stated, "These incidents are not merely unfortunate, they are entirely preventable," emphasizing the failure to meet basic responsibilities towards vulnerable individuals in care. This highlights a critical issue in mental health services that cannot be overlooked. The MHA reiterated that ensuring patient safety is not just a priority, but a fundamental right. They criticized the existing system for placing excessive pressure on frontline staff, while neglecting to address the underlying structural problems. In a show of solidarity with the affected patient and their family, the MHA cautioned against using such incidents as a rationale for imposing restrictive measures on other residents. They stressed that safety and dignity must coexist in a rights-based approach to mental health care. To address these pressing issues, the MHA has called for several immediate actions: an independent and transparent investigation to ascertain what went wrong and who is responsible, urgent investment in staffing, supervision, and infrastructure to enhance safety across all psychiatric wards, public disclosure of the investigation's findings, and the corrective measures that will be implemented, a swift reform plan that transitions away from outdated practices towards community-based, recovery-oriented services. The association urged authorities to stop treating each incident as a standalone event and instead recognize the evident pattern of systemic failures within Malta's mental health system. Mental health care cannot continue to function in a state of emergency, the statement concluded. We require long-term, rights-based solutions that prioritize dignity, safety, and accountability. For families and individuals involved in mental health services, the MHA has committed to providing ongoing support, advocacy, and a platform for their voices to be heard. This situation raises critical questions about the state of mental health care in Malta. Are we doing enough to protect our most vulnerable citizens? What changes need to be made to ensure that such incidents do not happen again? We invite you to share your thoughts and opinions in the comments below.